Dr. Scott Sherr, welcome to the show. How you doing?
It's great to be here, man. Thanks for having me.
No, it's great to reconnect. We met at an event a couple months ago, I suppose, and now
it was a couple years ago, so give yourself a break. It was a
couple years ago.
Years
okay.
ago. Yeah.
Yes.
Yeah.
Well, I'm excited to get into all the things because I know that you're an expert on hyperbaric oxygen therapy, methylene blue, which I've experimented with, but
Yeah.
I'll admit haphazardly. Like
Okay.
I'm not really, I have far from even cursory level knowledge. Is just like, I see a lot of people doing it, and it seemed, I don't know, like kind of a rite of passage to have the blue mouth thing.
Yeah,
right?
that was a thing. It was a thing back in 2020, 2021. Yeah.
Yeah, among the
We brought it to the world. Let's
among
call
the
it.
biohackers.
Yes. Yeah, that's how we started it. Yeah.
So yeah, I'm pumped to get into the science, but
Yeah.
let's dive right in. Why don't you, I guess, start with your background, the kinds of things
Sure.
of things that you study. I know that you're a clinician.
Sure.
And then yeah, we'll transition into all the things.
Sure. Yeah. So I grew up the son of a chiropractor. So that's how I grew up, very out of the box thinking. But I decided to go to medical school with like this high-minded idea that I could figure out a way to bridge the worlds of conventional and alternative medicine. I knew nothing about conventional medicine at all. I think I'd seen a PCP or like a pediatrician once or twice to get into college, but that was it. But so it was kind of a ride for me going to University of Maryland in Baltimore, doing the medical thing. I did my internal medicine residencies there as well. So I did the medical training, but I always kind of knew I wanted to get back to more of an alternative approach. I just kind of figured out how to do that. And then medical school, I figured out that there was this really cool technology called hyperbaric oxygen therapy, as you mentioned. And it was this amazing healing technology working in hospitals. When I learned about it in the hospital, I also learned that it was being used in a lot of different ways for healing and inflammation and wounds and lots of crazy, amazing things that we weren't doing in the US. And so I got very interested in that, and I kind of created a practice around that. So for about a decade or so, involved in hyperbaric medicine. And then from hyperbaric medicine, I got more involved in looking at an integrative approach to how to really optimize people more long-term. Hyperbaric therapy is a fantastic tool, but not everybody needs to go into a chamber right away. And I realized this very quickly when I saw people going in and then getting worse and not getting as well as I thought they would get. And then I realized that a lot of this had to do with energy metabolism, like how well they can make energy. Like in a chamber, you get a lot more oxygen in circulation. And so you have to be able to do something with that oxygen, hopefully make energy. And then hopefully after you make energy, you can detox from all that energy you just made. But as you and I both know, like most people have pretty screwed up mitochondria these days. And so 94% of the US population has some element of mitochondrial dysfunction. And so a big piece for that for me was like, well, what am I missing here? And I was missing a foundational approach. And so in 2017, I trained in something called health optimization medicine and practice. It's called Home Hope for short. And it was designed and founded by a guy named Dr. Ted Achacoso. And Dr. Ted is this fantastically smart anti-aging tricontinental practice governors, senators, presidents, and things like that. So he created this whole framework called health optimization medicine and practice, which I got trained in. And the focus is more on optimizing health rather than treating disease and looking at metabolic markers, something called metabolomics, which is the study of how cells are working, how well you can make energy, how well you can detox, your gut, your neurotransmitters, hormones, but looking at it from a health perspective. And so I started using that in my clinical practice. And so my clinical practice is basically a combination of hyperbaric therapy. I do consulting all over the world for people that are interested in hyperbaric medicine, but it's mostly a smokescreen for people finding me for hyperbaric medicine and finding out that 80% I talk to them about has nothing to do with hyperbaric therapy. It has to do with optimizing their health. And a lot of that has to do with finding out ways to help them now while they're on the longer path. And one of those is methylene blue. So there's the whole story for you.
Super cool.
Yeah.
Well, let's like break it down to like a grade school level. Like what, for somebody who's never heard of hyperbaric therapy before,
Yeah.
what actually is it?
Yeah, so it's a combination of increased inspired oxygen and increased atmospheric pressure. So most of us have heard of oxygen before, I hope. So in California, where we are now, you're at 21% oxygen. So LA, sea level is 21%. Where I live in Colorado, it is 16% oxygen. Okay. But what we do with that oxygen is it gets carried on our red blood cells. Red blood cells carry our oxygen no matter where they need to go. We have 1 billion oxygen molecules per red blood cell. Fun fact. There's 250 million hemoglobin molecules, which is the molecule that carries oxygen on our red blood cells. So that's typically how much oxygen we can carry. Now, how can we increase the amount of oxygen that we carry? We can do that a couple different ways. First way is that we can increase the number of red blood cells in circulation. We can do that by coming to visit me in Colorado and go altitude training, and you'll release a hormone called epogen or EPO. This is also the hormone that people take as an injectable for performance enhancement, right? So Lance Armstrong this is the doping drug, right? And so you can increase your number of red blood cells using this particular hormone, whether you come to altitude in Colorado or if you take the drug itself. So you can increase the number of red blood cells to increase your oxygen carrying capacity. You can give yourself a red blood cell transfusion as well. So people have done this before races, before, to increase their oxygen carrying capacity. Now, the other way this can happen is you can actually dissolve more oxygen into the liquid of your bloodstream, or the plasma of your bloodstream. The plasma has very little oxygen in it at sea level. But when you increase atmospheric pressure, which is the other part, you can increase and drive oxygen not only on those red blood cells, if there's any sites left, but actually into the bloodstream, into the liquid of the bloodstream. You've probably had a pulse ox on your finger before, right?
Yeah.
A pulse ox, what that measures is how much oxygen is on that hemoglobin itself. So it doesn't measure how much is in the liquid of the bloodstream. So your pulse ox is always going to be fine if you have normal lungs. If you're in, it should be 96 to 100%. But so in a hyperbaric chamber, we're going to increase that to 100%. And then some that you're not going to be able to measure on a pulse ox because it's into the bloodstream itself. So that pressure, so we increase the pressure, we simulate the pressure you feel under a certain amount of seawater. So water is extremely heavy. You're weightless when you're swimming in it, but if you carry a bucket of water, like it's heavy, right? And so that heaviness is what we simulate in the chamber. And that heaviness shifts your physiology through a physics law called Henry's law that just says the more pressure you put on a gas, the more of that gas is going to go from a gaseous form to a liquid form. And so you're dissolving a huge amount more oxygen into the system itself. And that has a huge amount of effect, both immediately and long term. Immediately we're flooding the body with oxygen, so you reverse low oxygen states. So as you can imagine, if you've had a stroke or a heart attack or traumatic brain injury or your limbs hanging off or something, like getting more oxygen in circulation is going to be really, really helpful. And so it's going to do that immediately. It's also going to decrease inflammation immediately and decrease swelling. It's going to release stem cells, which are the baby cells in our body that can go anywhere in circulation and make new tissue. It's also going to fight infection. It's going to improve immune system function, and it's going to help with lymphatic and blood flow as well. So that's all immediately what's happening in the chamber. And then long term, what happens is that there's an epigenetic shift, which is how our genes transcribe themselves depending on different sort of stimuli. And then all that oxygen coming in has this effect at expressing our genes differently. So we actually have new blood vessels that form. We create new tissue of those stem cells. We prevent scarring. We decrease inflammatory factors like interleukins and TNF alpha and things like that. And then, we fight these infections and things like that. So it's a massive healing modality, both acutely and over the long term as well.
But there's got to be a downside, right? Like oxygen is
Sure.
oxidative.
Yeah, there you go.
Which is
Yeah, yeah.
pro-aging.
Okay. Oh, I appreciate that. Right. So there's a lot of things that cause oxidative stress, right? And this is really important because when you're actually going into the hyperbaric chamber, you are causing oxidative stress. You're doing that because you're increasing the amount of oxygen circulation, as you assumed, and you're correct. And then a lot of that oxygen is going to make energy. Some of that oxygen is go directly to make oxidative molecules, and some of that's going to be the byproducts of energy metabolism of ATP production. And so what happens is the body has to respond to that by creating an antioxidant response to neutralize that. Just like if you were doing hormetic stress of exercise or high heat sauna, your body goes through stress, and then the body should, in quotes, should be able to react to that and build itself back stronger if you have the right machinery involved to be able to do that. But the challenge I found in the beginning of my hyperbaric practice is I found that many people don't have that machinery, or at least it's not as optimized as it could. And so, because the idea is that that oxidative load is actually what's causing that epigenetic shift that I mentioned. It's causing the stem cells to release, it's causing the immune system to rev up, it's causing a fight an infection, for example. So those are all good things. But if you don't have that antioxidant capacity, that neutralization capacity, you're not going to feel good. And that's something that I found very early in my practice that was burned me a couple of times, thinking that people would get better in the chamber, but they didn't. And in fact, they got worse. Now, it's not uncommon to feel a little bit worse. Actually, Dom D'Agostino, who you may know, he did a paper on hyperbaric therapy. He's a ketogenic guy. And he did a paper where he showed about 3 days after your hyperbaric exposure is when you have a direct neutralization reaction that's equivalent to the oxidative stress that you first had during hyperbaric therapy. So it takes about 3 days. So it's not uncommon for people to feel like a little bit worse when they're going, but if they feel like they're just down and like they can't move afterwards, it's often because they have too much oxidative load to start off with. And so what I found over the years is that if you have an acute issue, if you have something acute where acute trauma, acute infection, acute low oxygen state, like you don't want to pass go. You want to get into a hyperbaric chamber as soon as possible because you want to reverse that low oxygen state. Okay. But if you have a chronic issue, like a long-term, you have dementia or mild cognitive impairment, or you have a chronic infection, or you have a chronic pain or something like that, you don't often want to start with hyperbaric therapy. And that's where people get in trouble, I think, is that And I get in trouble in the hyperbaric community by talking about it because I actually got disinvited from a conference because the title of my talk was going to be, please do not put them in the chamber. But if you have a hammer, everything looks like a nail, right?
Yeah.
So my deal is that if there's an acute issue, like you're going to get surgery, for example, we can talk about, like, that's a great time to use hyperbaric therapy because you know that you're just going to reoxygenate that tissue, right? That's really the most important part of it. And you can support otherwise. But if it's a long-term thing, if you've had a concussion for 6 months, then it might be a really good idea to get into a chamber. But what about optimizing your blood-brain barrier, your gut, your vitamins, your minerals, your nutrients, and your hormones, right? If you can do all that, maybe you don't even need to go into a chamber. Or if you do need to go into a chamber still, you're still going to do a whole lot better overall. And so the framework that I use, the health optimization medicine and practice framework, is what I use in clinical practice, where if somebody comes to me and say, hey, Scott, or Dr. Scott, I had a concussion or I have migraines, and migraines is a good one. For whatever reason, I get a lot of people that have migraines. And I'm like, well, great, you have, or not good, you have migraines, right? You're asking about hyperbaric therapy. What else have you done? Like, oh, I take migraine medication. I'm like, okay, what else have you done, right? And if they haven't done the whole process of thinking about how they're going to work on their whole system, then I know that hyperbaric therapy is not going to work for them long term.
Okay, so let me see if I can synthesize this, like everything that you've shared thus far. So basically, you need to have a relatively high level of baseline resilience, robustness, health to make this therapy, this tool work for you.
If you have a long-term goal using the therapy, yeah. If it's an acute issue, then no problem. I call it, do not pass go. The chamber is going to help you heal faster.
And so it has obviously direct benefits in terms of the flooding of oxygen that your system gets while in the chamber. But then there's also these indirect benefits that you get through a hormetic mechanism.
Exactly. Yeah. So you nailed the nail on the head. And then the third thing is that there's the pressure-related aspects of being in the chamber too. The pressure of the chamber actually increases energy production and also flow both in blood vessels and detoxification, so your lymphatics. So like a micro massage for your blood vessels kind of thing.
Very interesting.
Yeah.
So is this technology, generally accessible to the average consumer? They're huge units, they're expensive. I have a hyperbaric system in my house.
I have one of mine. I have a soft-sided chamber. We can talk about different types of chambers, but it is now, over the last 4 years, especially since the pandemic, it's just kind of gotten crazy overall. Nobody really knew about hyperbaric therapy even 4 or 5 years ago. And now most people know, I've heard about it before. They might call it there's funny names people call it, hyperbolic or bariatric. I'm like, it's not bariatric surgery, man. But, or what's the other one I get? Cryo. People think it's cryo or something like that. So, but now people know about it because you have elite athletes using it. Like LeBron James is famous for getting in and out of his hyperbaric chamber. You have like Djokovic, which is the tennis player who travels around to every one of his tournaments with a hyperbaric chamber in a trailer in the back of the truck. And so you have athletes that are using it. For now, it's well established, and you're now seeing it also in performance. Not only in performance, but you're also seeing it in more and more clinics that are using it more for chronic complex medical disorders and issues as an adjunct most of the time in those, right? So it's, as I was kind of alluding to, if you have a chronic complex medical illness, hyperbaric therapy is not going to be your first stop, right? If you're an elite athlete though, or you're an athlete and you're just looking to recover from like a workout, for example, you can definitely use hyperbaric therapy. But then the key is how much you use and how deep you go, right? The deeper you go in the chamber, the more pressure you're putting yourself under, the more stress you're putting yourself under, right? So the milder pressures are great for neurocognitive optimization. The brain's more sensitive to oxygen, and also for what I call day-to-day operations, like your jet lag, your exercise recovery, your performance boost, even because after you get out of a chamber, you have about 30 minutes of oxygen at higher levels compared to what you would have had before going into the chamber. So you can use that to do more work, do more aerobic training. Even oxygen utilization actually goes up for about 24 hours after being in the chamber too. So it's pretty significant. And there's some really great studies to show this as well. So
what does the chamber that you have in your house look like?
So I have a soft chamber in my house. It's a mild-sided unit that has, it's a nylon material. People are getting hard chambers at their house now that are going to 2 atmospheres, which is more of like our medical grade pressure. But more and more people having, so for my house, I have a 1.3 atmosphere chamber, which is the equivalent of about 15 to 20 feet of seawater. And I have oxygen coming through an oxygen concentrator through a mask that I use inside the chamber.
So it doesn't require an oxygen tank, it just concentrates what's in the atmosphere?
Yeah, so it depends on the type of chamber you get. So if you're getting like a deeper pressure chamber, like 2.0, which is 33 feet of seawater or deeper, then you need to have more, either have a number of concentrators together, like kind of put them up in series, or you have to get bottled oxygen or liquid O2. Because what happens is that the oxygen has to get into the chamber and it's pumping against the pressure of the chamber itself. So most concentrators are like 10 liters a minute. And so we can get that if you put two of them together, 20 liters a minute, you can usually get pretty good flow rates at about 2 atmospheres, but nothing deeper than that. There are some, go ahead. Yeah.
Interesting.
Yeah.
This might be a stupid question, but why couldn't you just like breathe in concentrated oxygen for the same effect?
I'm glad you asked that question. It's a good one because of the pressure. Because we're increasing the amount of pressure in the system. So by increasing atmospheric pressure, you're driving oxygen not only on those red blood cells, but also into the liquid of the bloodstream as well. So that is the real power of hyperbaric therapy. Without pressure, you can't do that. Now, you have some arguments by some people that the soft chambers, as a result of the amount of oxygen you're getting in, that you could do the same amount of oxygen with a face mask. But what they forget also is that the pressure, not only does it help get oxygen in, but the pressure itself is a physiologic mechanism. It's a catalyst for change. And so there's tons of studies, even small amounts of pressure being like hugely beneficial. So like a good example would be, going to the Dead Sea in Israel, right? There's just a small amount of pressure there and a small amount of extra oxygen, but it's been known for thousands of years as a healing environment where you have people going there for respiratory issues and cardiac issues. And yes, the mud is nice and that's all, beneficial for your face and things, but it's, it's the increased pressure there that's so beneficial.
Fascinating.
Yeah.
Can you give us a sense of like cost? Like what do one of these chambers cost?
Yeah, so a soft chamber for the house is going to run you anywhere. I mean, there's a huge range. It's going to get anywhere from about $8,000 or $10,000 to about $25,000 for
wow.
Yeah, but again, with the way I kind of think that this is going to happen, Max, is that you're going to have, it's just like your Peloton bike eventually. Like you're going to put it on like some sort of monthly payments system and get one because it's such a fantastic healing modality.
Or like economies of scale, like more people demand them.
Yeah. Exactly.
As they become aware of them, it'll potentially help drive the price down.
Yeah. And the hard chambers, so it's really important to know, so the medical grade chambers that go to 2.0 or deeper, that's where most of the research is overall. There was a great anti-aging study done in Israel in 2022, I think, that showed that hyperbaric therapy over a protocol would increase telomere length and decrease senescent cells, or these zombie cells that build up as we get older. So that was a really great study. And so you have more people that are interested in it, but the deeper pressure protocols are the ones that are more systemic overall. So full body kind of protocol versus the mild ones are more for brain health, for cognitive health, and overall, day-to-day operations. But the caveat to that is that if you're doing other stuff, if you're the way I always think about this is like, what are you doing before, during, and after hyperbaric therapy to kind of leverage, right? And before is that you can dilate blood vessels to get more oxygen to tissues. You can optimize energy metabolism so you're getting more energy produced. I use methylene blue for that, but I also use, B vitamins and minerals and things like that because so many of us are deficient in those as well, like, magnesium, obviously. So how can you increase the amount of energy that you make? And then as a result of that, you've got more blood flow to the tissue. I think that with the milder units, you can approximate deeper pressures for some things, but only with more of like an integrative approach overall. But in essence, the medical grade chambers are more expensive. People do get them at their home. They range anywhere from like around 50 or 60K to 150K for the house. I mean, but there's different varieties of them and safety factors and things you want to think about there. But I just kind of frustrated with the whole ecosystem in about 2019 and 2020. And because I saw people using hyperbaric therapy ineffectively, or there's a lot of companies out there now that are selling chambers that don't really give a lot of advice, or they give the wrong advice. Or installing chambers in people's homes that people don't need and things like that. So what I've been trying to do since that time is educate more about like the differences and what's important and medical grade versus soft and knowing that, a lot of people are also integrating lots of things together. They're using their lights, their sauna, their cold plunge or whatever. Like people get these home, biohacking suites of things now. So trying to find ways to do that. So I did create a company and it's called One Base Health that does a lot of this kind of ecosystem integration. And the idea is to try to connect all these devices together, push out protocols to you that are kind of personalized to you. So that's all kind of new and happening, which I'm excited about.
That's dope. When did this therapy first appear in the zeitgeist? Wasn't it rumored that Michael Jackson used to sleep in one? Yeah,
it's a great story. So the technology itself has been around since like 1660, actually.
1660.
Yeah. And so what they did was they just had a closed chamber that was completely sealed. And they would attach an organ bellow to it, and they just would either blow air into it or suck air out. And that was either a hyperbaric or hypobaric chamber. They had no idea what it did though, at all. And it was used in various ways in sort of not real medicine in the sense of just like they found that if you increase the amount of oxygen in there, so if it was a hyperbaric, it would heal certain things, and if you took air out of it, it would heal other things as well.
Interesting.
Yeah, and so you had these surgical suites that would go around with these hyperbaric units, but it didn't become a medical technology until decompression illness and the bends coming from diving and from building bridges in the late 1800s and early 1900s. And then when they concentrated oxygen, that was the other piece. So the Navy really became the main people to start hyperbaric therapy at that time.
Why was Michael Jackson sleeping in one?
Oh yeah,
allegedly.
So nobody knows for sure if he was sleeping in one, but he did own one, and he owned it because of that Pepsi commercial where he was burned in the 1980s. So he had third-degree burns on his head filming that Pepsi commercial, and as a result of that, he purchased a hyperbaric chamber, which is well known to heal wounds and burns, for his home. He used it to heal the wounds on his head and maybe had some pictures taken in the process. And when he was finished, he donated the chamber to Cedars-Sinai and in LA in their burn unit. Yeah.
Whoa.
So it's one of those, real and not real kinds of things with Michael Jackson being like the classic tabloid for like one of the first guys that was really kind of pressed by the media. Right.
Yeah.
So, but he was using it to heal wounds in his head is what it comes down to. So, yeah.
Wow.
Yeah.
He was a biohacker. Who knew?
Yeah, I guess. Now sleeping in the chamber, I don't recommend doing that, by the way, because you only want to get a small amount of exposure.
Because it's hormetic. After
Exactly.
all, right?
Yeah, exactly. So you hear about athletes, especially for whatever reason, like sleeping in their chambers. Like if you did that like as a one-off every once in a while, it'd probably be okay, but you don't want to do that regularly because of the oxidative stress, right? We did talk about how the deeper you go, the more oxidative stress you have. So it's really important to me when I'm thinking about mild hyperbaric therapy, like the soft-sided units up to about 1.5 to deeper. Like if you're going deeper and you have a longer term issue.
What do you mean by deeper?
Deeper pressure. So more pressure in the chamber.
More pressure.
So like if I'm in my unit, I go to about 15 feet of seawater. If it's a deeper pressure unit, it goes to like 33 feet of seawater, 45 feet of seawater. If you're going deeper and you have a longer term protocol for an issue, let's say it's vascular dementia or a concussion or chronic pain or something, this is where the other aspects become so important because the deeper you go, the more stress you're putting on the system, right? And this goes across the spectrum of people like that are super sick and that have chronic complex medical illness, and also to your athletes. Like you don't want to put an athlete that's in training and likely not getting enough rest at a deeper pressure because they will go into over-oxidation and they will feel like terrible. And they'll get detox kinds of symptoms, right? They'll get joint pain, they'll get muscle aches, they'll get GI issues, they'll get headaches. These are the detox things that I'm sure, when people get too much hormetic stress. It's no longer hormetic, it's now just stress. Yeah. It's not eustress anymore, it's distress. And so that's always the key for me is like, how are you going to, and this is kind of my way into health optimization medicine, my way into methylene blue is like, the avenue was, why aren't people doing well? Realizing that they're not doing well because we're putting on an oxidative load into the system and that they need more support. They need more support on the input side, which is the machinery that's required for us to make energy. So how can we break down our macronutrients, our proteins, our carbs, our fats, and how can we make energy from those and all the cofactors that are responsible and all the intermediates in the process. And then at the same time, obviously flow electrons through our electron transport chain in our mitochondria effectively. And when many people have complexes on the mitochondria that don't work very well because of so many different things. And then on the other side of things is the detoxification side, right? So my practice, what I do in consulting now with a lot of people is working on both of those sides at the same time, knowing that if they want to really benefit from being in a chamber, they really need to be thinking about that. Otherwise, I've seen people, somewhat improve even, but oftentimes they will go back to the way things were before. And one of the things we don't have in the hyperbaric literature are any long-term studies of how people do long-term. And so I do worry if there's not really an injury, even if there's an injury to heal. I've seen people deteriorate over time, even if we thought we've healed that injury, if they were doing the same thing that got them to where they were, right? So if you're eating McDonald's 3 times a week and drinking alcohol every night and then going to hyperbaric chamber to cure your concussion, whatever benefit you get is likely going to be short-term, right? And so it really does become the bigger conversation of how we're going to optimize, macronutrients, micronutrients, energy metabolism in the mitochondria, especially those complexes that get really messed up with lots of things in our environment, with toxins, medications, infection, and others, and insulin resistance, of course, too, which is a huge issue with mitochondria. Address all that and then address the detox side of things as well. Yeah.
So how should listeners, viewers then think about this as a tool, and how should they stack it among the things that they're already likely doing?
Yeah. So when we're talking about methylene blue, we're really talking.
No, I mean hyperbaric.
Hyperbaric.
Yeah.
Okay, you look in here, so I wasn't sure.
Yeah.
Yeah. So the way I think about hyperbaric therapy is, it's a fantastic accelerator and healer of wounds, especially in an integrative context. So if you're gonna get a chamber and you want to use it for like day-to-day operations, a little bit of, let's call it health span optimization, right? So exercise recovery, jet lag recovery, a little bit of muscle stuff here and there. Like the mild units are very safe. They are really easy to use, and you can't really get in a whole lot of trouble using them, except if you use them too much. Like that's the other thing. You don't want to use a chamber every day, every night for the rest of your life. You want to take breaks from them. You want to go intermittently. And the way it kind of works is, I was alluding to this earlier, like if you have an acute issue, a couple treatments can go a long way. But if you have a long-term issue or a long-term goal, say you want to improve your exercise performance long-term, like endurance or something like that, then you need to go in for 30 or 40 sessions, 5 days a week to see the benefit. Okay. Now, if you're thinking about adding it in, it really depends on your goals, right? If your goals are athletic performance, that's one set of things. If your goals are longevity, that's another. And so what I always say is that I need to know your goals, and then we can decide what kind of chamber would be most beneficial for you. But oftentimes, unless it's like a very significant wound or like something that hyperbaric therapy is definitely going to heal without any other issues, it's like oftentimes it's going to be multiple steps before I would even recommend hyperbaric therapy, because once you get into a chamber, you're going to benefit so much more, right? If you're pretty well optimized, when you go into a hyperbaric chamber, you're going to feel pretty awesome, right? If you're not that well optimized, you're not going to feel that good, but the caveat is that what I'm really kind of discussing here is the deeper pressures, right? If you're going to milder pressures, they're not going to hurt you, most likely. You're probably going to feel better unless you're really over oxidized and pretty stressed overall. But in general, what I recommend is that know what your goals are and know what hyperbaric therapy is doing. It's going to decrease inflammation. It's going to increase oxygenation. It's going to improve your immune system, et cetera. But it's also a gradation. So like if you're starting off, if you just need some mild help, then the mild chambers. If you need more help, you need to go deeper. Then you also need more, integrative support to go along with it.
Is there, I'm sold on the potential benefits, but it's obviously very expensive. It's not the most accessible technology. Is there anything from like a DIY standpoint that might replicate at least some of the benefits that you see from hyperbaric?
Yeah, it's a good question. So I totally understand it's an expensive technology and not everybody can benefit. And that's why, 80 or 90% of what I talk about with people that consult with me on hyperbaric therapy has nothing to do with hyperbaric therapy, because there are probably 9 other things that you could think about doing to help support whatever you're going through, and maybe you wouldn't need to go into a chamber. I may say for some things, if you've had a stroke or traumatic brain injury or something very specific, or you have a wound, I'd be like, you need to get into a chamber, right? And we need to do a couple things to get you there. But overall, the only way that I've approximated it a little bit, there's a couple different therapies out there. So exercise with oxygen therapy. So HBOT is it called? So you can breathe 100% oxygen or close to it while you're riding a bike. That will increase your oxygen delivery that way. And so that's another option. It's not as systemically impactful as hyperbaric therapy, but
so you don't get the pressure.
You don't get the pressure, exactly, yeah. And then there's also hypoxic training. So hypoxic training is going to flood the system with more oxygen if you do hypoxic training as well, but you have to be healthy enough to do hypoxic training to start off with, right?
Yeah.
So hypoxic training is when you bring your oxygen levels down lower, and then you and you can either exercise on those low oxygen levels, or you can have them on lower and then bring them up higher when you exercise. It's called like adaptive training, right? If you do adaptive training, you're going to get more oxygen flooding the system and released into the tissue because you've been hypoxic for a little while. So those are some of the things that you can do. In general, the basics are the most important, right? So, dialing your diet, your lifestyle, your supplements, your nutrition. And I use, what's interesting is I use a lot of methylene blue in this case because it helps with oxygenation, it helps with energy production in the mitochondria, and also helps with inflammation as well. So in people that can't afford hyperbaric therapy, or they're just kind of starting off in their health journey, like it's something that I start off using a lot of actually, because methylene blue here, because methylene blue is so supportive to the mitochondria itself overall. So
talk to me about methylene blue. What is methylene blue? I've tried it, as I've mentioned, but I'm a total novice, so school us.
So the reason why I use it so much is that it's a mitochondrial optimizer, and it does this in some pretty unique ways. And so we were alluding to this before, but it's about 94% of the U.S. population has some element of mitochondrial dysfunction. So it's severe. And what that typically means is that they either have a hard time making energy or detoxing, like we've been talking about. So, and the cool thing about methylene blue is that it can help on both sides. So what it does, it's methylene blue. This one over here, my friend. There you go.
Dope.
This one over here it's called Just Blue, and it's 16 milligrams of methylene blue. Okay.
And your company is what, called
Troscriptions. Yeah, Troscriptions is the company. So the background on that is that, talked about the nonprofit. We have a nonprofit education company called Health Optimization Medicine and Practice. And that's what I'm trained into as my sort of integrative as foundation. And so we created Troscriptions a couple years later as the for-profit side of it to help people right now while they're on the longer path of health optimization, which, can take a long time. And some people, 6 months, a year, longer. So what are you going to do right now? You need help with energy, right? And that was kind of the first place we went. And so we went with methylene blue because the studies are actually quite good, but this is a very interesting compound. It's a very old compound. It's been around since the 1870s. It used to dye blue jeans blue as a textile dye. And somehow they realized that it also treated malaria. And so in 1897, it was the first drug registered with our FDA as a treatment for malaria. And it was also called the magic bullet at the time because you could give high doses of methylene blue and it would kill pathogens, organisms that you don't want there, but it wouldn't harm normal cells. And so it had a very storied history between 1897 and 1950 as one of the only antimicrobials around: antifungal, antiviral, antibacterial, especially gram-negative bacteria. And so World War II pilots back in that time frame needed to carry methylene blue with them when they were in the Pacific. And they had stories of methylene blue because it has a very interesting side effect, which is that it makes your urine blue. And so they would have stories about urinating blue and things like that. So at higher doses, a milligram per kilogram, so 70 milligrams and above, it has a significant anti-infective capacity. And that's because it increases something called hydrogen peroxide in the system, which is really great at killing bugs overall. So, but after about 1950 or so, when penicillin came around, methylene blue kind of got, put to the wayside. The first antipsychotics were actually derived from methylene blue too, interestingly. It is what's called a monoamine oxidase inhibitor, which means it prevents the breakdown of serotonin, norepinephrine, and dopamine. And so if you're on an SSRI, for example, or SNRI, or taking a dopaminergic drug, you have to be careful when you're taking methylene blue. And I don't recommend doing it unless you're with a provider helping you overall. But so the first antipsychotics were derived from it, but then methylene blue also concentrates in the mitochondria itself. And it is the antidote and still on the World Health Organization's list of essential medications because it's an antidote for cyanide poisoning. Whoa. Yeah, so I hope nobody gets poisoned with cyanide. Don't go to Russia anytime soon, maybe. I don't know. But cyanide, what it does is it destroys one of the complexes in the mitochondria. And so the mitochondria have these four complexes, complex 1, 2, 3, and 4. And the fourth one gets destroyed by cyanide, but methylene blue has this really amazing ability to maintain electron flow through and make a gradient and still help you make energy, even if you have this destruction of one of the most important complexes outside of the ATP one as well that makes the ATP. So yeah, so you have this compound now that's been studied for the last couple decades. There's a really great researcher. His name is Dr. Francisco Gonzalez Lima. He's at the University of Texas, Austin. And he's looked at a number of different Alzheimer's models, looking at using methylene blue as a way to compensate for the mitochondrial destruction that happens as a result of this particular illness. There's also been studies in traumatic brain injury, in stroke, depression, bipolar, mostly, and we know those are metabolic diseases as well as mental health issues as well. So we use it, and I use it in clinical practice as a way to compensate for almost any mitochondrial dysfunction. So any of those complexes that aren't working very well, what methylene blue can do is actually bypass them and allow electron flow to continue, so basically, for like a quick primer on maybe mitochondria for people is that like you have these complexes, electrons flow through it. These electrons come from our food, NAD, everybody's heard of NAD these days. FAD is the other one, complex 1 and 2. And so electrons flow through, and then they create this gradient where these protons they go across to help create a gradient between two sides of the membrane of the mitochondria. And then the protons come across this ATP rotor. It's like a machine rotor that makes your ATP, right? And so what methylene blue can do is help compensate for any of those complexes that aren't working very well. And complex 1 and complex 2 are very commonly affected these days with the things that I mentioned earlier, toxins in our environment, medications. Metformin actually is a complex 1 destroyer. The goal with metformin is to give you more mitochondria and help them make sure, and hypothetically, they might be better if you make new ones. But I don't really get why you stay on it long term then, honestly. Yeah. But people, that metformin is one of those drugs. PPI, so proton pump inhibitors, also affect complex 1 and complex 2. Infections like COVID or long COVID absolutely affecting those complexes. Mold illness, EBV, other viral illnesses, other toxins in our environment, cosmetics, the toxins in our water, in our food supply, and things like that are affecting it. So, 94% of patients or of the U.S. population, it's a huge number of people. So
it basically helps your mitochondria function more efficiently.
Yeah, because it helps you allow you to make more energy, right? And the cool thing about it, on the other side of it, it's called a redox cycler because it can do both. It can help make more energy and clean up the process of making energy and regenerate some of the energy producing parts of your cell. And at the same time, it works directly as an antioxidant. And so it can pick up that oxidative load and neutralize it directly, especially at low doses, at like 4 milligrams, 8 milligrams, 16, 25. These are lower doses. When you get to be higher doses, over about 1 milligram per kilogram, that's when you get more of the anti-infective capacity. And that's also where you get more of the rescue capacity for your mitochondria. So if you have an acute trauma, acute low oxygen state, you could potentially use methylene blue and reverse or at least mitigate some of that damage. So all of my patients have higher strength methylene blue in their medicine cabinets just in case. And then pre-post surgery, we use it a lot. We use it when people have infections or colds and things like that.
How can it help post-surgery?
Well, post-surgery, you have a lot of inflammation, right? And there's also, as a result of that, you're going to get mitochondrial stress. And so as a result of that, and there's also higher risk of infection post-surgery as well. And so we've seen, at least anecdotally, people using methylene blue, pre-post-op and decreasing risk of infection. I have a lot of actually dentists that use methylene blue as a way post-op to prevent tooth infections and mouth infections overall. So.
Wow, so interesting. Is it a natural compound or is it synthesized?
No, so it's fully synthetic, and that's a big issue. So during the synthetic process, it can be contaminated with heavy metals, including mercury, cadmium, arsenic, and lead, I think. And so as a result of that, you have to be really careful where you get the sources from. And with us and our company, we really were very, very careful and continue to be, because we've had to throw out thousands of dollars worth of compound before. And I really do worry about people buying things on Amazon and not really getting a lot of information from where they're getting their sources from, or if the companies are providing their certificates of analysis, which we always do. Like, I'm a clinician first, and I want to make sure I'm not doing anything to be a detriment to my patient's healing as opposed to helping them. So if I'm giving them a little bit of methylene blue with lead, I don't think that's really what I want to do. So what I'll do is, what we do as a company is make sure that we have the cleanest stuff possible. So there's a great headline in the beginning of the pandemic. About 6 months in, we were just selling the product, and it said, biohackers drinking fish tank cleaner to reverse their age. And so that's because methylene blue is in fish tank cleaner, actually. And it's obviously contaminated with other things. So I don't recommend anybody please drink fish tank cleaner. But it's a great clickbait headline, right? And so, but it just goes to show you that methylene blue does have a history in lots of different arenas. But the key is you got to make sure you get clean stuff if you're going to take it orally, or you're going to take it, human consumption without any heavy metals, and making sure it's tested really well before you use it.
Are there any other risks? I mean, assuming that it's pure. I mean, has there been any connection between any association between methylene blue and, for example, cancer?
No. So the key is the dosing. Okay, if you keep it super low dose, it's actually very, very safe. However, there are some things to think about, right? So if you're pregnant or breastfeeding, you shouldn't take methylene blue. There are some very poor studies, but studies showing that it might have an effect on, the mom or the baby. So really just the baby, obviously. So don't recommend there. Because it's a monoamine oxidase inhibitor, it increases norepinephrine, dopamine, and serotonin. So there is so the first thing to say there is that if you have high blood pressure, some people with high blood pressure will see their blood pressure rise on taking methylene blue. Now, a corollary to that is that we're seeing lots of people with positional hypotension and tachycardia using methylene blue and having a significant benefit to their symptoms as a result of the blood pressure increase that's happening. And another piece of this, which we didn't talk about, is that methylene blue also has a significant effect on nitric oxide production. And there's different types of nitric oxide. There's nitric oxide that happens when we have an infection, and that's the type of nitric oxide that methylene blue kind of neutralizes. It doesn't really affect in a negative way the nitric oxide that's made by our mitochondria itself. So you have where was I going here with this? So
risks, high blood pressure.
That's right. Thank you very much. So we have the high blood pressure risk, but also because it's increasing serotonin and norepinephrine, you have to think about those antidepressants, as I talked about. So There have been a couple studies that showed IV methylene blue, high doses with high doses of serotonin reuptake inhibitors would potentially cause serotonin syndrome, which is dangerous and can kill people, right? But it's never been shown with oral methylene blue before. But even still, and we're using very low doses with what we do, but we still recommend if you're going to use methylene blue, you're on an SSRI or SNRI, you have to work very closely with your provider before you'd want to start it. That's a major thing. And so other risks are detox kinds of symptoms. And so, because you're revving up energy production and your detox pathways when you're using methylene blue, you can find some people will have like your detox kinds of symptoms. But if you go very slowly with the dosing, like the key with methylene blue, or Just Blue here at 16 milligrams is really just to slowly titrate your dose. You don't want to start off with a full troche, and we can talk about that, what a troche is, but the dose escalation every 3 to 5, maybe every 5 to 7 days, depending on how sensitive you are. That's really the best way to kind of figure out where your right dose is going to be. And for some people, like if it's a chronic issue, they may have to take it for weeks or months as their system is optimizing itself. And hopefully when you're optimizing vitamins, minerals, nutrients, and cofactors and doing all that too, and your lifestyle, your diet, of course, then you can slowly wean them off of the methylene blue. In others that are doing more for performance-related reasons, or travel or things like that, then you can use it more intermittently depending on your needs. Right?
Yeah, is this the kind of thing that you want to take like every day to see the benefits of, or is it something to be thought of in a more like acute setting if you want like a mitochondrial boost? Or
it could be both. It could be both, really. It really depends on what your needs are. So if you're relatively well optimized, taking it a couple of days a week when you have more stress, for example, like if you don't sleep very well, or you're going to be under bad lighting all day, or if you're going to travel especially. So traveling is a big stress on our mitochondria. We know that. So at sea level, which is where most of us are, and then on an airplane, you're at 8,000 feet pressurization, right? So that 8,000 feet pressurization has much less oxygen in the air. So you're much higher risk for jet lag, infections, and feeling terrible when you land, right?
I've actually taken it the last time I flew transatlantically.
Nice.
To London. Yeah, I had heard about it because I've actually bought from you guys before.
Yeah.
Just to make it clear for listeners, like there's no commercial affiliation here. I'm actually a customer. I've bought some of your guys' stuff, and I remember taking it before, or maybe during or after. I don't remember, but it was like around. It was like around the flight.
Yeah.
I remember. Not having much jet lag.
That's great. It's kind of one of those things where if you don't have something, it's hard to know that you didn't have it, right? And it's hard to if you didn't get sick, well, would I have gotten sick? You don't know for sure. But it really does work that way. And we have a full jet lag protocol on our website that talks about how to stack your methylene blue dosing depending on your timing at the destination where you're going to try, because obviously when you're trying to travel, many of us are trying to shift our time zone before we get there, or trying to get on that time zone as fast as we can. So you can use methylene blue to help you actually.
Yeah. Very interesting.
Yeah, and we have another product called Blue Canatine, which is a combination of methylene blue with nicotine, caffeine, and CBD. That's that one. That's a sample product. Yeah.
As a medical doctor, are you for or against nicotine?
I'm for nicotine, low doses, not smoked, not vaped. Okay. Nicotine itself has great studies. I'm not sure if you're aware, but great studies on mild cognitive impairment, cognitive ability, verbal fluidity, memory recall, so much. It's short acting. It's great. Now, saying that, high doses, especially with vaping products and cigarette products, so if you have a vaping product, it's at least 10 to 20 milligrams per hit. If it's a cigarette, it's 26 milligrams of nicotine in a full cigarette. Okay, that's on average. And
26 milligrams in a cigarette.
In a cigarette, yeah, and it's about 10 to 20 milligrams of nicotine per hit, I think, on the nicotine vapes. It might be a little bit less than that. I'm not exactly sure, but in addition, not only do you have nicotine, but you also have the additives in both of them. And they've shown in very many studies that the additives are increasing the addictive capacity of nicotine. No doubt about it that nicotine itself is addictive. It increases dopamine, serotonin, norepinephrine. It does that. But if you have a slow release formula, like we have in something called a buccal troche, which is a dissolvable lozenge that goes between your upper cheek and gum here. And the nice thing about that is that these troches they're scored so that you can actually break them up into quarters, halves, or fulls very easily. So you can kind of optimize your dose. You can do that with all of our products. But then in addition, it bypasses metabolism in the liver. So liver slows everything down and also degrades everything, right? And that's what liver's supposed to do. But if you dissolve it up here, within about 5 to 10 minutes with the Blue Canatine, you're going to start feeling your focus, your productivity, your flow, and it's just going to be like you feel on, which is great. And it has CBD in there, and the methylene blue as well, they're both very protective at the same time. So you don't get the come down or crash or anything like that. So like for traveling, oftentimes the methylene blue while I travel, the just blue, and then the blue cannatine when I get to my destination and I got to be, on so that I can rock whatever, what I'm doing that day, that kind of thing. So
yeah. I had been, for its nootropic effects using nicotine for the past, year, I would say.
Okay.
I was using like the pouches.
Yeah.
And also recreationally. I mean, I just enjoyed it. And then a month ago, I stopped cold turkey.
Yeah. How long did it take you to feel?
I didn't find it addictive. I mean, here's the thing. It's hard to parse whether or not you're addicted to something versus whether or not you just like doing it, Yeah. And I guess
it's the physical dependence versus psychological dependence.
It was so easy for me just to stop. I just put them all out of view and I stopped.
Did you have any symptoms when you stopped?
Zero.
Yeah. So nicotine does typically have a withdrawal effect if you've been taking a lot of it.
Maybe like 24 hours.
Yeah, but it's
not
like
a slight headache.
It's very, very mild overall. So it's not like coming off of caffeine or something like that where you get headaches for a month or something. And that's related to a lot of different aspects. But nicotine in general, low doses, less than 4 milligrams a day is what they say is not addictive if you're not vaping it or smoking it. So in our troches in the blue cannatine, it's 1 milligram per full troche. And the average dose is a half, which is just obviously a half a milligram of nicotine. So
wow, yeah, it's pretty low dose.
Very low dose, has a little bit of caffeine in there, 50 milligrams, 50. So it's just a quarter cup of coffee. But even just a half of that with some methylene blue and CBD, it feels like being on a stimulant, but without the jitters, without the come down, without the crash. And so we have, practitioners that are working with patients to wean themselves off their stimulants, their prescribed stimulants, using this instead. And so I obviously don't recommend doing that without a physician helping, but this is a fantastic way to not be on those, right?
Does methylene blue by itself have any stimulant properties?
So it's not a stimulant per se. Like what people would feel when they're on methylene blue is they feel like this rise, like this subtle energy, sort of wide focus, just everything lifts a little bit. But it doesn't feel like you're snapping your fingers like, oh my God, I can do whatever, put it in front of me, let's go. That's more the blue cannatine because that has the stimulants in there with the nicotine and the caffeine.
Yeah.
So, but for me, what I use on a regular basis is the Just Blue at low doses. And I use that in a lot of my patients as well, as I'm supporting them through the process of their health optimization journey, which can be long for many people.
How do you avoid having a blue mouth all the time if you're using it every day?
So good question. So with the Just Blue, the pure methylene blue, I usually recommend swallowing it actually. And the reason for that is that methylene blue is very highly bioavailable. So it's our one product that we have that I do recommend swallowing if you don't want to have a blue mouth. Now, the caveat to that though is that if you do have more cognitive symptoms, more brain fog, fatigue, concentration, those who use it in their mouth, they do feel better faster that way. Methylene blue is so unique because most supplements, I always use the example of NAC. If you take 100 milligrams of NAC, only 10 milligrams of that is going to get into the body, right? It's at 10% bioavailable. With methylene blue, it's just about 100% bioavailable, whether you take it in a troche, whether you swallow it, or obviously if you get it in the IV too. And so what's going to be different about methylene blue in that case is just going to be how fast it gets into the system compared to, the other routes of administration. So
would you not want to take it around sleep?
Right. So I usually recommend starting in the mornings because it can make people feel more active, more energetic, but not in a stimulated sort of way. It doesn't usually keep people awake, but usually want to start it off in the morning. Sometimes you can dose it. I'll dose it in my patients twice a day. Sometimes 8 o'clock in the morning and about 1 o'clock or 2 o'clock in the afternoon. And the key for me is that, as you're alluding to earlier, is are we doing intermittent dosing? Are we doing everyday dosing? It really just depends on the person and what they're going through, right? If I have somebody that's coming to see me with chronic fatigue and inflammation and a lot going on, then I'm going to be like, well, you know what? Maybe we should really have you on this daily, find your right dose that's helping you, and then keep it on there for a while before we start weaning it down. Methylene blue is going to help your mitochondria work better. It's going to help regenerate the mitochondria. We're also doing these other things like getting you outside and changing your diet and making sure that you're not snoring next to somebody or something. If there's a snoring partner, get rid of the snoring partner, go into a different room. Sleep divorces are real and they're good. Go for them if you need them.
I support, yeah.
Yeah, do you know, I think it's about 50% of U.S. couples or something like that
are now getting a sleep divorce?
Yeah, they call it a sleep union now. I think they're trying to make a positive spin on it, but stress is a big deal, right?
Yeah.
And so the other piece that I think about a lot is not only to energetically optimize people, but also to work on the parasympathetic side too, right? That's the off switch of our brain. And I don't have any products with us on the table, but we have a number of one that are based on the GABAergic system specifically.
Well, this is a ZZZ.
Oh yeah, that's it. Yeah, we have that, the Z, yeah. So the Tro Z is a sleep aid that we created that leverages the GABA system. Because like while we were looking at products to help our patients with the health optimization journey, we were looking at energy, number one, but we're also looking at parasympathetic activation, because most of us are just on all the time and don't know how to shut off. And that's because we're depleted in one of our the most important neurotransmitter for inhibition or decreasing firing, called GABA aminobutyric acid. And so GABA is 20% of our brain's neurotransmission, and nobody thinks about it because everybody thinks about norepinephrine and dopamine and serotonin. But glutamate is the excitatory neurotransmitter, that's the primary, and GABA is the inhibitory, and they're always in balance. And glutamate actually gets converted into GABA in the brain. So it's this fine balance between those two. And then if you're always overstimulated, you're always going to be depleting your GABA, and you're always going to have too much glutamate around as well, because you're depleting other things that help with the conversion of glutamate to GABA, like B6 and magnesium. So what we found is that when you're doing testing for people, you find it's really important to optimize, of course, your vitamins and minerals on all sides. But on the GABA side, glutamine is your precursor amino acid. So glutamine is something we get from our food, meat products typically, cabbage and sauerkraut too. And that glutamine is also the primary fuel of our gut. So if you have a leaky gut, you're not going to be getting a lot of glutamine in the system. It's mostly going to be taken away trying to heal the gut. But glutamine gets converted into glutamate, and then glutamate gets converted into GABA. So thinking about the precursor amino acid, vitamin B6 and magnesium help the conversion of glutamate to GABA. But we're GABA deficient for all these other reasons I was describing, because of stress, because of vitamin, mineral, nutrient deficiencies, because of toxins, blah, blah, blah. And so the problem is that repleting the GABA system is not straightforward. GABA supplements shouldn't work. If you take a GABA supplement and it works for you, it means that your blood-brain barrier is not doing what it was supposed to do.
Interesting.
A leaky brain. What that really means is that you likely have a leaky gut as well. That's causing inflammation and then causing your blood-brain barrier, which is supposed to keep things out, to allow things in. So GABA shouldn't get across, but if it does, it's actually almost diagnostic clinically that somebody has a leaky barrier that needs to be addressed. And so what we wanted to do was find a way to enhance the GABA system without using GABA directly, right? And so we did that using a couple of different compounds that are really interesting. One of them is called, in TROZ, is called agarin. Agarin is from the fly agaric or the Amanita muscaria mushroom. Have you heard of that mushroom before?
I've heard of it, but yeah, I don't know anything about it.
So it's the one with the red cap and white spots, and it's psychedelic. It's thought to be maybe the reason for Christmas and Santa Claus and reindeer.
Like the Super Mario Brothers mushroom.
And Super Mario Bros. Exactly. And Alice in Wonderland. Exactly. You got it. So the mushroom itself, when it's raw, is toxic because it has something called ibotenic acid in it, which is neurotoxic. If it's dried, there's less of that in there. But the other ingredient is agarin. And agarin is a long-acting molecule that goes to the GABA receptor, binds where GABA would bind, and sticks on there for about 6.5 hours. So it's great for sleep because GABA is so important for sleep. If you're GABA deficient, by the way, you have a higher risk of having anxiety, insomnia, and depression, right? Because when you don't have enough GABA around, you can't sleep, but also your mind is racing because our thoughts very much are regulated by our GABA production. And so do you know how many thoughts we have per day? Fun fact. Any guesses?
A couple thousand?
70,000.
70,000?
Yeah.
Thoughts per day?
Yeah, that's why I say don't believe everything you think, right? So
how the hell do they quantify that?
It's interesting, right? I have no idea, but they've quantified this somehow, that about 70,000 thoughts per day. But when you're anxious and you're depressed, you have about 120,000 thoughts per day on average, right? So the idea is to get you back down to your baseline of 70,000 thoughts so that you can go to bed, right? And so having more GABA around helps regulate the information that's coming from out from the environment, because GABA has this cool mechanism or cool function of being what's called an interneuron. So it sticks between other neurons and helps regulate the flow of information. And that's why we don't get bludgeoned by information all the time. We have so many inputs, but GABA is kind of helping
it's inhibitory.
Yes, exactly. It's regulating that. Also, we don't get bludgeoned by all that because it's inhibitory. So the key for us was to use something that could bind to the GABA receptor where GABA binds, called agarin. Then we have something else in there called hanakyle or hanokiol from magnolia bark, which you may have heard of before. And that's working on another site of the GABA receptor, increasing the affinity for GABA to bind, or in this case, agarin, because agarin's around. So what we did differently here is that we've combined them together. Most supplements will just have something that binds to a separate site on the GABA receptor, increasing the affinity for GABA to bind. But the problem is if you don't have enough GABA around, what's going to happen, right? It's not going to go well over time. So this is people that are taking kava for long periods of time, right? Or even things like what's another good example? Even what's another good example?
Chamomile.
Chamomile has also got some GABA. There's another one that people, regardless, the kava is the big one that I can think of. Is that
Valerian?
Yeah, valerian's another one, right? So valerian root is also working on the GABA receptor as well. But these are going to deplete GABA over time, even though they're not as severe as taking like a benzodiazepine, like Ativan or Xanax, which binds to these separate sites on the GABA receptor too, and then increases the affinity of GABA to bind so tightly that you get tolerance and withdrawal and dependence as a result of that. Alcohol, the same thing, binds super tightly to the GABA receptor at these separate sites, increasing GABA to bind, depleting your GABA as well. So supplements can do this, but not as significantly. But so what we did in Troz and also Trocom, our other product that work on the GABA system, is that we have a combination of the two together. The combination is this one that's increasing affinity, that's the Hanakyle, and then the other one that's binding to where the GABA would bind itself, the Hanakyle itself. The Agrin. So
you guys have pretty high dose melatonin.
Yeah,
here.
That's 5 milligrams in that one. Yeah,
isn't that pretty high though?
So melatonin physiologically dosing is probably in the microgram dosing. However, with a lot of people as they're getting older, they do need more melatonin production, right? So I find that for this one, if you're already sensitive to melatonin, then you probably don't need a whole lot of the Troz to make it work. It's really great as well if you're traveling a lot. The dosing of 5 milligrams is really quite good overall.
For jet lag.
For jet lag and things like that. So I find that it's a great reset for people that are having a difficult time sleeping because it does help. But what I tend to do in clinical practice is I will use it, but I will try to wean people off of it so they're not using it all the time. Because there's a couple of things that people worry about with melatonin that I think are unfounded. One of them is that it's going to decrease your own melatonin production. There really is no evidence of that. So if you take exogenous melatonin or you take it by pill or whatever, it's not going to decrease your own production. That's number one. Number two, people worry about testosterone production here. They think that melatonin is going to decrease testosterone. There's really no evidence that that's the case either, actually.
I've never even heard of that.
Yeah, it's another thing that's been around for a while. I have my colleagues in the cancer space that are using very high doses of melatonin because melatonin not only works to help you sleep, it also is a profound antioxidant. It's one of the most powerful antioxidants that we have. So we're using it in Troz for that reason too. So melatonin we think about in the brain, but actually melatonin's the primary antioxidant in our mitochondria. And so we need melatonin production and we need extra support when we have mitochondrial dysfunction too.
It's super interesting.
Yeah.
I want to go back to methylene blue. Isn't there an interesting synergistic relationship between methylene blue and photobiomodulation, like red light exposure? There
is, yeah. So near-infrared light, specifically around 680 nanometers, has been shown to donate electrons or rev up energy production by donating photons specifically, to complex 4 of the mitochondria. And so what methylene blue can do as well is donate electrons directly to the same location. So they are synergistic in that capacity. So if you take some methylene blue and go out in the sunlight, you're going to see and feel a significant rise in energy as a result of that.
Interesting.
Now, that's at low doses. At high doses, what near-infrared light or what methylene blue is actually a photosensitizer. So it's being used in cancer treatment now and an infection as what's called a photosensitizer, which means you can use methylene blue on board while you give high strength and high directed near-infrared light for things like breast cancer. Actually, some interesting studies on breast cancer using methylene blue as a photosensitizer. So, and it's also been studied there's a great paper that used methylene blue at high doses with sunlight or like sunlight exposure for COVID infection actually as well. So we know that it's an anti-infective at these high doses and also can be potentially anti-cancer as well, which is pretty interesting. Yeah.
Can it make you more prone to sunburn?
Not that I'm aware of. No, I don't think it would have a mechanism in that capacity. I think one, it's kind of a funny story for me. Like you can potentially overheat. So be careful because funny story. I was taking a walk in 105-degree heat here in California, actually, and with a friend, and I had taken methylene blue earlier in the day, and I was drinking water, but I was trying to figure out like why I was overheating, and I didn't know why. And when we got back to his house, I had to like cover myself in ice packs because I was on the verge of heat stroke, and I was like, what did I do differently? And I was like, oh, it was the methylene blue. So because it was providing me so much energy and making like that synergistic heat that was the byproduct of energy production, I was getting overheated as a result. So just be aware of that, I guess. Like if in very, very hot weather, potentially that could happen. So
very interesting.
I had all these like ice packs. It was a good picture. It was kind of funny. Yeah.
When I was a kid, like in high school, I I was reading about for whatever reason. Well, actually, I know why. I grew up in New York City and I was prone to seasonal affective disorder.
Yeah.
Just the winters and whatever.
It could be rough.
Yeah. My
I grew up on Long Island, so I know. Yeah. We had more sun than the city, I think, though. Yeah.
In Long Island, yeah, for sure.
Yeah.
Because, I mean, the city, what little sun there is like blocked out by the buildings.
Yeah, exactly.
So I would notice every winter my mood would get so dour that I began looking up natural antidepressants, and I stumbled upon the research on St. John's wort.
Yeah.
And so I went to my local like GNC at the time, and I picked up a bottle of St. John's wort, and I was actually taking it for quite some time. And I remember that it very well could have been a placebo, but I did notice that it boosted my mood. But then I found out the hard way that one of the side effects of St. John's wort is that it's a photosensitizer. And if you're taking St. John's wort and you're already prone to burning in the sun, and then you go out and you spend like, an excessive, stupid amount of time in the sun,
Sure.
it can like really damage your skin.
Okay.
So I went on vacation one week with my parents, my family, and I got really badly sunburned to the point that I had like scabs on my face.
Oh no! Okay.
Yeah, it was really bad.
Yeah, that can happen with some of the antibiotics that cause photosensitization, but
Wild.
But it's not, methylene blue doesn't do that overall, so you don't have to worry about that. But you do have to think about if you're in the sun for a long period of time, you're going to make a lot more energy, and I didn't realize that's what I was doing. And that's why I had to decrease my core body temperature pretty quickly, so I didn't have to take myself to the ER. So
crazy shit.
Yeah.
So if you take one troche has 16 milligrams of methylene blue in it. If you divide it in 4, because I noticed that they're like slotted.
Yeah.
Right.
I can show you if you want. I can tell you.
Please.
Yeah. It's kind of a cool mechanism. So we have to squeeze here. We make them child safe, so you have to squeeze there and pull, and then they're in this little well like that, and you open them up, and so
just pop one out.
Yeah. So the way they work here is, that's the troche there. And so they're scored in the middle. So you can see I don't know if they can see on the camera, but you can try to take a look at that, maybe like that. I don't know. That works.
Yeah.
But it's scored there, so you can cut it up into quarters, halves, or fulls. I'm obviously a pro at this because I do it all the time. So if you get good at it, you can just do it with your hands like this, and you can just make it into quarters.
If I take one now, what time is it? It's about 3 p.m.
Yeah, you should be good. You should be good. I mean, if you want, you can just swallow it just with some water. If
I'm
you
going to do that.
I think you're going to be on
I'm doing Fox News.
Yeah, you're doing Fox News later, so we don't want to.
So I'm going to just swallow it?
Yeah, just swallow it. Yeah, unless you want to have a blue mouth for Fox News and give us an advertisement.
I definitely don't. I'm glad that I didn't just like reflexively put it in my mouth.
Yeah. So if you do that, your mouth is going to turn blue pretty quick, right? So you can
for like hours too. It's wild.
Well, it depends, right? And we have some mitigation strategies if you want. So the best one actually is matcha green tea, interestingly enough.
Wow.
And I found this out from Isabella Wentz, so I think but she's like, yeah, I drink matcha after I have my Just Blue and it all goes away. I'm like,
interesting.
That's amazing. Yeah. But baking soda also helps. Hot liquids also help. Eating can also help the blue go away. So, but like I said, with our pure blue, if you want to swallow it, that's okay. Just have it on an empty stomach. And then I typically have people eat about 15 to 20 minutes later, if possible, because that's going to drive it kind of through. And I know if you guys most of us have had the experience that you have something on an empty stomach and then you eat and then you feel it later after you eat, right? Because it's kind of gone through faster.
Yeah.
This may or may not have happened to me when I was in high school and I had pop brownies and I didn't know that I felt anything until I ate something and then I couldn't move. So that's
I get it. I think we've all been there.
Yeah, I was so pissed because I went to a concert and I couldn't pay attention. It was very, very sad. But anyway, so you can swallow Just Blue and that's okay. The other ones we have like the Z here, it can be swallowed too, but it's better to dissolve in the mouth if you can because it's going to help with sleep. And then our Calm, the one actually I don't have it on the table. It's orange. That one, best in the mouth as well. What I found is if people don't want to have, put things in their mouth and have the troche dissolve, they tend to need a slightly higher dose so like if you take a half of this and it worked for you, as a troche, you might need 3/4, for example, if you did it and you swallowed it overall.
There's something fun about putting a troche in your mouth though.
Yeah, it is
like
fun.
A little lozenge.
Yeah, it's like a lozenge, but the one thing I should mention also, so there's sublingual, of course, but buccal is different. Buccal lozenges are different because there's 8 layers of mucosa up here. So it's a slow release. If you take something sublingual, most of this is just getting swallowed.
Sublingual means under your tongue.
Under your tongue. Sublingual,
so buccal means what? Like
between your upper cheek and gum.
Where you might put like a nicotine pouch.
Yeah, do you put pouches up here too? I thought you put them down here. I don't know.
Both,
yeah. So up here is more of the ingredients are going to go into your bloodstream through your mucosa up here, as opposed to down here.
Interesting.
And especially up here, like in your sublingual area here. So upper cheek and gum is the best place. And so we knew about troches from medical practice, right? So we've known about ketamine troches and hormone troches for decades. And so we just decided to use that technology to make the products as well. So, I mean, the key for us was ease of delivery, titration, and then addressing things that people needed help with now while they're on the longer path of optimizing their health, right? And that's energy, as we discussed. That's focus. That's our blue carnitine with our nicotine and caffeine. That's our sleep product, our Troz. That's our calm product as well on the GABAergic system. And then we also have something for the immune system called Tromune, which is a high strength extract of the cordyceps mushroom called cordycepin. And cordycepin is a very powerful, about 100 times more powerful as an immune system modulator as the mushroom itself. And it also increases deep sleep. So I use it regularly when I travel, and I give it to my kids, and it's fantastic. So,
cool. I'm gonna try it tonight.
Yeah.
Well, Dr.
I brought you
Sherr,
some. Yeah.
Yeah. Thank you for the education, man. This was super fun. And just to remind listeners and viewers, this was not sponsored.
Yeah.
Just, happy to learn more about these compounds and these therapy modalities.
Well, I just would say,
stuff.
I would say that just that, like, thank you for having me, Max. I think that what it comes down to is that the key, and this is different from most companies, is that if you don't need my products, I am happy, right? If you need them, they're there for you, right? So like anxiety, stress, immune system function, can you manage all these things with diet, with lifestyle, with optimizing your foundational health? Absolutely, you can, but it's not always easy to do that, right? So my hope always, and I tell my patients this, is that I hope I can wean you off as much as I can as we optimize and dial in your diet and your lifestyle. And this is what my health optimization medicine framework that I use in my clinical practice and is all about, right? And then we have the nonprofit called Health Optimization Medicine and Practice as well, that is training practitioners on how to optimize health rather than treat disease. And so it's a focus on these kind of optimization strategies, optimizing, your vitamins, your minerals, your nutrients, your cellular health, your gut, your hormones, your neurotransmitters. But the focus is not so much on finding the root causes of any disease. It's more focused on how can we keep you healthy or optimize your cells to be healthy. They once were, we can get them back there, right? So trying to focus on nutrient and gut networks and hormone networks and optimizing those between 21 and 30 years of age. So not just you're normal for your age. We don't want to be normal for our age. We want to be optimal. And that's really between 21 and 30 years of age for most of us. So the big picture is that for me, education is key, and that's what I talk to patients about every day. And the key is also to use things when you need them, and then you might need them more when you start as you're getting going. And then as you get more through your journey and get through some of those bottlenecks and roadblocks, then you need them less. And then, you can have them when you need them, when you're traveling or when you're having a hard time sleeping instead of, more often.
Amen. Well, where can people learn more? How can they pick up and try some of your products at Troscriptions? Maybe you can offer like a discount code to my listeners, like
sure.
Genius or something?
Sure, Genius 10.
Code Genius 10?
Genius 10 it'll
Great.
be. Well, it will be. Genius 10.
Dope.
That'll be 10% off their order, no problem. And you can go to Troscriptions.com. That's where our website is. We have tons of blogs, tons of education. I do all the education. If you're a practitioner, we also have a practitioner portal, so you can check it out and you can get a wholesale account, learn about all the clinical things that you can't really talk about on a podcast because they're clinical, but we have a lot of great research and that we talk about a lot on our portal side for the practitioners only. And then you can go to Troscriptions on Instagram at Troscriptions, and that's where you can find a lot of information as well. And then my personal one is at Dr. Scott Sherr, DrScottSherr. If you're interested on the hyperbaric stuff at all, we have my company is called One Base Health, and we make chambers and technology and integration of various devices, which is really fun. And then I think those are the places. Oh, then also the nonprofit is homehope.org if anybody's interested in training and learning more about what we do.
Love it. Thanks, Dr. Sherr, for coming out. Last question.
Sure.
That gets asked everybody on the show. What does living a genius life mean to you?
Living it one moment at a time. Life is lived in moments, not in looking at the past, looking at the future. Life is now, right? And so most of us get so stuck either in the beginning or looking at the past or looking at what's going to happen, anxiety, stress. If we, I have a good colleague that likes to say that, and I don't pretend to be here, but enlightenment, if that is a thing, is lived in moment by moment. So that the gurus of the world, the best, the most sort of dialed in people that have done the meditation things and all that they live moment to moment. And that's all that we can do. Nothing else exists.
Exactly. Be here now. Love it.
Be here now.
Thanks again for the knowledge and the wisdom and the products. Super appreciated. And thank you guys for listening. Share this episode around with friends and loved ones that might benefit from it. And happy biohacking. Have a good one. I'll catch you on the next episode. Peace. Hey, if you liked that video, you need to check out this one here, and I'll see you there.